Hello, my name is Thomas Johnstone. I'm a first-year medical student here at Stanford, and today I'll be talking about the use of antibiotic-impregnated polymethylmethacrylate plates for prevention of periprosthetic infection and breast reconstruction. I'm part of the Division of Plastic and Reconstructive Surgery, and specifically part of the care group, and I'd like to thank everybody who helped out with this before I get started. Okay, so just to begin, periprosthetic infections remain a major challenge for breast reconstruction. Local antibiotic delivery systems, such as antibiotic beads and spacers, have been widely used within other surgical fields, particularly orthopedic surgery, but their use within plastic surgery specifically remains scarce. In this study, we demonstrate the use of these PMMA plates for infection prophylaxis in tissue expander-based breast reconstruction. In terms of our methods, we did a retrospective review of patients who underwent immediate breast reconstruction with tissue expanders placed in the prepectoral plane over the span of 5 years, performed by 2 surgeons. Data pertaining to patient demographics, operative details, and postoperative outcomes were recorded. 50 patients underwent tissue expander reconstruction with the addition of a PMA plate impregnated with tobramycin and vancomycin, which are both heat-stable antibiotic compounds, which is required because the plate construction is an exothermic reaction. Antibiotic plates were removed at the time of tissue expander to implant exchange, and then a patient matching analysis, especially on demographics, was performed using the 397 patients who did not undergo PMMA plate placement. We then generated a 50-patient non-intervention cohort for statistical analysis. In terms of our results, the intervention cohort, which was again the size of 50 patients, and a 1-to-1 matched non-intervention cohort, demonstrated no statistically significant difference in demographics or operative characteristics, other than, of course, PMMA plate placement. The rate of operative periprosthetic infection was 0% in the non-intervention cohort, or in the intervention cohort, excuse me, and 12% in the non-intervention cohort. And that difference was statistically significant at the P is less than 0.05 level. The rate of explantation was also reduced in the intervention group, 2% versus 16%, respectively. That was also significant at the P equals 0.05 level. Follow-up average 4.3 months and 38 months for the intervention and non-intervention groups, respectively, as the intervention group is a relatively recently developed technique, so we haven't followed it up for too long. In conclusion, local antibiotic delivery using antibiotic-impregnated PMMA plates can be safely and effectively used for infection prevention with TE-based, tissue expander-based breast reconstruction. And while antibiotic-impregnated plates have been previously shown to be beneficial in the salvage setting, this study represents the first application for infection prophylaxis. We do need future studies with long-term data to characterize risks of things like capsular contracture, reoperation, and patient-reported outcomes. We hope that further studies will determine the risk of these complications. They should also characterize the side effect profile of antibiotic-impregnated PMMA plates relative to that of systemic antibiotic administration. Similarly, a cost-benefit analysis might be helpful in the future to determine if antibiotic PMMA plates should be used in all patients or whether they should be used in patients who are at particularly high risk for developing breast implant infection. Thank you so much for listening. I'm free to answer any questions that you may have at the email listed below, tjohns3@stanford.edu. And again, take care, have a great rest of your day, and I hope you enjoy the rest of the poster sessions. Take care.